And while you were sleeping, as Melissa Botich and Jeremy Slevin write over at, this printed out without a, I think this was Think Progress. I'm pretty sure. I could be wrong. Anyhow, last night while you were sleeping, the Senate debated and ultimately passed a budget resolution that provides the pathway for Republicans to strip health coverage away from 30 million Americans without one single Democratic vote. And just, by the way, it's Friday. It's Anything Goes Friday. Feel free to give us a shout. We can talk about anything you want. I got a couple news stories here I want to share with you. Some of the things that are going on today. My thoughts on those, but anything you'd like to talk about, feel free to call. So, anyhow, here's what the Republicans voted on last night. And the only two Republicans who voted against, who didn't go along with all the other Republicans on all these issues, or not on all these issues, on a couple of these issues, were Susan Collins of Maine and Dean Heller of Nevada. Now, Dean Heller's up for re-election in 2 years, and Susan Collins is notoriously, arguably, the only rational Republican in the entire United States Senate. And rational, even there, is an arguable word. But here are the things that the Republicans voted on last night. This was in the vote-a-rama. This is the Senate. Number one, do away with protections for people with pre-existing conditions. 52 million Americans right now. That's 1 in 4 Americans have a pre-existing condition. That's 1 in 4 non-elderly Americans. I mean, by the time somebody gets to be 50, 60 years old, they've probably got a half a dozen pre-existing conditions, right? And in fact, the broad way that the insurance companies just a couple of years ago were interpreting pre-existing conditions. I don't know if you recall, but there was a drug that was marketed back in the 60s and 70s to stop acne that causes some kind of weird cancer 20 years later. As I recall, it might have been associated with liver or pancreatic cancer. I mean, it's been a year or two since we've done the story, but we actually had, somebody whose family had on this program. I mean, this might have been 4 or 5 years ago. That acne drug, had you taken that drug, like literally, this is what was happening. The pharmaceutical companies you'd be in your 40s, and suddenly you get cancer, and you show up at the hospital, and you go to the doctor says, okay, we need surgery for this. You go to the hospital, you check in, and they say your insurance has been repealed, and if you want this surgery, you're going to have to write us a check for $30,000. And you go, what the hell? And you call the insurance company, and they say, oh, well, even though you're 40 years old, we went through your medical records, and we learned that when you were 16 years old, you had acne, and you took this drug. And one of the side effects of this drug is this particular type of cancer that you have, so probably you've had this pre-existing condition all along. We're going to cancel your health insurance. And I mean, it's crazy. So that was the first vote. Shall we protect people with pre-existing conditions? Donald Trump said he's going to. But the Republicans in the Senate, no, they voted to do away with pre-existing condition protections. In other words, to say to the health insurance companies, once again, if somebody has ever had an illness in their life and it comes back, or if somebody's changing health insurance companies, say somebody's diabetic and they're with Aetna and they decide to drop that policy and go with Blue Cross can say, sure, we'll pay for everything except your diabetes, which, can be a lifelong condition, particularly if it's type 1 and has all kinds of complications associated with it, which can be life-threatening and life-shortening, but they're all part of that pre-existing condition. So that was the first thing the Republicans did last night, is they gave the giant finger to 1 in 4 non-elderly Americans and virtually everybody over 50. That was their first vote. The second was, should young adults stay on their parents' plan up until the age of 26 if they're going to college or if they're living in mom's basement or whatever it may be, or even not? If parents have a decent plan through their employer, can they extend that to their kids until they're 26 years old? It's very popular, 85% support nationwide. The Republicans said, no, we're going to do away with that. Number 3, maintaining access to contraceptive coverage. Republicans blocked that provision. See, these were all amendments that were offered by Democrats to get Republicans on the record. None of these votes actually. Now, for those of you with pre-existing conditions, those of you with kids under 26, and as we continue through the list here, there's 6 of them altogether. Don't panic yet, because this is not making law. This was, well, it's the first step. The Republicans are trying to push through a bill to repeal Obamacare. And then, once it's done, it'll just sit there until they've got the replaced, and then they'll roll, or at least that's the plan according to Mr. Trump. I mean, who knows? But once they propose this repeal, because they're trying to do it by budget reconciliation, the Democrats cannot filibuster it. But what they can do is they can add amendments and force a vote on the amendments. In other words, get people on the record. And every Republican in the United States Senate, except Dean Heller and Susan Collins, voted to eliminate Medicare, or eliminate access to contraceptive coverage as part of the Affordable Care Act. In fact, according to this article, thanks to Obamacare, spending on contraceptive health care has gone down by 20% since the Affordable Care Act took place. Kirsten Gillibrand, senator from New York, wanted to continue that, put in an amendment saying, okay, if you're going to repeal Obamacare, just don't repeal this part of it. Republicans blocked her amendment. The next amendment that they blocked was to ensure that Medicaid stays in place, Medicaid expansion. Now, most of the red states have not taken that money, free money. They have not extended health care to the working poor, to people in their states that make less than whatever the state threshold may be, typically around $25,000, $30,000 a year. If you make less than that, you can get Medicaid basically for free. You can do that in all the blue states, but not in any of the red states. And by the way, that has benefited 11 million low-income Americans so far and has created thousands of jobs for healthcare workers. The Republicans voted to do away with that last night, or they blocked the amendment from Bob Menendez of New Jersey to keep that, shall we say. Children on Medicaid, this would be the children of the working poor, and the Children's Health Insurance Program. This was Hillary Clinton's, signature piece back in the day. Republicans blocked an amendment offered by Senator Sherrod Brown that would ensure children could keep their health coverage on Medicaid or Children's Health Insurance Plan, CHIP. And number 6, protect veterans' health care. While the Republicans blocked an amendment by Senator John Tester, the Democrat from Montana, that would have made it harder to restrict veterans' ability to access VA health care. Amazing. While Democrats have sought to provide better funding and health care access at the VA, Donald Trump has proposed eliminating the agency altogether through privatization. Incredible. And now I think the reason why all these Republicans are so gung-ho for repealing Obamacare is becoming obvious. And it really boils down to simple greed. I mean, yeah, there's some ideology there, like poor people don't deserve to live and health care should be a privilege, not a right. And the rich think that they're blessed by God and they're superior and therefore, they're entitled. But what has been very rarely reported, and most people who make less than a couple $100,000 a year had no idea of, is that there is a tax on people who make more than $200,000 a year that helps fund the parts of Obamacare that pay for care for poor people, for low-income people, the subsidies and things like that. I'm not talking necessarily about unemployed people. I'm talking about people who might be working 3 jobs, but it's just none of them pay, more than $7, $8 an hour. And it turns out that all these millionaires and billionaires are really angry about having to pay a tax to support the poor people, low-income people, average people, for that matter, on Obamacare. Jonathan Cohn wrote a great piece over at Huffington Post. Repealing Obamacare would give 400 of the richest families in America a tax cut worth an average of $7 million each. even as it yanks health insurance away from low and middle income Americans. On average, these families have incomes of $318 million a year, according to the report, which means the $7 million tax cut they would get is roughly equivalent to increasing their incomes by 2%. Now, I was looking around for what the percentage is, and I don't frankly know, but I think apparently it's in the neighborhood of 2%. And so just giving that tax break, doing away with that tax, that 2% tax on incomes over $200,000, just doing that for the 400 richest families in America, the 400 highest income families in America, would be a revenue loss to our government of $2.8 billion. These guys are full tilt boogie, ready to go. Let's cut the taxes on the billionaires. That, you know, when they talk about repealing Obamacare, increasingly it's looking like what they're talking about, what they're really talking about, is cutting taxes on millionaires and billionaires. Just that simple. We'll be back with your calls.